I rise to speak in support of my amendment with Mr. Peters. For many years now, I've been committed to addressing drug prices in a meaningful way. And Americans, regardless of political affiliation, have made it clear Congress has to actually act and get something done. The legislative process is intentionally deliberative, and there is demonstrated ability to address the high cost of prescription drugs in a bipartisan, bicameral fashion, and we have done so in a number of areas already. Last Congress, we took a partisan approach in this chamber to pass H.R. 3, despite bipartisan efforts in the Senate from both the Finance and Health Committees. While I reluctantly participated in that process, it was not without making clear my reservations for the mechanisms in the bill. Medicare should be able to negotiate drug prices, absolutely. We do so in Medicaid, we do so in the VA. But we should not be using an international pricing index or an excise tax that is so harsh that it hardly qualifies as negotiation, as we've heard, and according to the Congressional Budget Office, stifles innovation. With a 95% excise tax, industry would have to abide by whatever the Secretary's determination of price is or face going out of business. We do not have that type of penalty attached anywhere else where we negotiate prices. That's an unacceptable solution to the high cost of drugs. It sets up a vicious cycle of killing jobs and innovation that drives cures for these rare diseases that we had no opportunity to deal with before. And it would have prevented us from being at the forefront of the COVID-19 vaccine development. I would also point out that H.R. 3 has failed twice. It has no chance of passing the United States Senate. The amendment before you today reflects an updated version of a bipartisan proposal that came from Senators Grassley and Wyden out of the Finance Committee in 2019. And the bill also adds and includes an opportunity to negotiate drug prices on the most expensive drugs on the market that Representative Peters talked about, Medicare Part B. HHS has found that over the 2006 to 17 period, Medicare fee-for-service Part B drug spending per enrollee grew at an 8% annual level, more than twice as high as Part D, and 3 times as high as the nation's overall retail drug spending. I believe government should intervene when there's market failure. We cannot sustain that growth rate. Medicare currently pays 106% of the average sales price for Part B drugs. In our bill, it goes down to 65%, already a guaranteed discount for those drugs outside of their exclusivity period. Since beneficiaries pay a coinsurance of 20% on these drugs, their savings would be life-changing for anyone needing to use any of these innovative drugs. Data from 2013 shows that the range of costs that a beneficiary currently pays on Part B drugs range from about $2,000 to over $100,000. That's untenable. We need to act. While my major concerns lie with the negotiation provisions in the drug pricing title before us today, I'm also very concerned we have not taken advantage of the 2-year period to improve policies that were initially rushed through the committee process in 2019. My amendment today addresses a lot of those changes. This amendment includes policy to provide an out-of-pocket cap, as Rep. Peters talked about, Medicare Part D, that offers more help for seniors that need it most than any other proposal out there, including the one before us today. One of my greatest concerns has been with the exorbitant increases in the cost of medications that have long been on the market. In just 4 years, the cost of insulin has doubled. We heard good testimony to that effect, and that's unconscionable. Shouldn't happen. I used it a lot in my veterinary practice. It used to be very affordable. To that end, our amendment tackles insulin directly by capping out-of-pocket costs at $50 a month. And for the first time, seniors will really benefit from the rebate system, see a significant decrease at the drug counter, because we ensure that cost sharing is based on these discounts, not the list price. We also maintain the inflationary rebate provisions like those in Grassley-Wyden that limit price increases to virtually the same as inflation. Gaming by the industry to extend patent life, keep generics and biosimilars off markets, and other loopholes in the approval process are the reason we have so many high-cost single-source drugs. System's broken, but rather than uproot it entirely, we take the necessary steps to fix it. All these proposals have had bipartisan, bicameral support and are included in our legislation. I support Mr. Peters' intention to withdraw today, but I sincerely hope this is generally the beginning of a conversation on drug pricing policy that can actually be signed into law. For too long, seniors and families across my home state of Oregon, across America, struggled to afford the prescriptions they need to live. We were elected to do better, and I think we can do better, Mr. Chairman, and I yield back.